Welcome to the Vaccinations and Health in Uruguay podcast.
Great to be here.
Today, we're doing a really interesting deep dive, looking into vaccinations and health in Uruguay. We've got quite a few sources lined up.
Yeah, we're pulling from official government info, COVID stats, up to March 2025, planning documents from early in the pandemic.
Right, and also things like entry requirements, residency rules going back to 2018, WHO data.
Even details on vaccine availability and uptake. So a pretty broad picture.
Exactly. Our mission today is basically to pull out the key stuff, the really interesting bits, and give you a clear, engaging overview of how things stand with vaccinations and health there.
This is good. Where should we start?
Okay, let's kick off with the national vaccination scheme. It sounds like Uruguay has a pretty organized system for residents, right?
Yeah, absolutely. The government sources really emphasize this. Every resident can get an official vaccination certificate.
And this isn't just like a printout, it's official.
Exactly. It holds the same weight as the traditional carne verde, their green vaccination card. And the access seems, well, quite straightforward.
How so?
Anyone can just walk into any vaccination center, public or private, anywhere in the country. Show a valid ID, and they'll give you the certificate. It comes straight from the National Vaccine Information System, the SIV.
Wow, okay. That sounds super efficient. Makes proving your status much easier, I imagine.
It definitely seems to streamline things. And it's all digital, pulling from that central SIV system.
Does that mean the old paper carne verde is, on its way out?
Well, not necessarily obsolete. The digital system is obviously convenient, but they do say the paper records are still valid, so there's flexibility.
Good to know. What if the digital system doesn't have everything, like older shots?
Yeah, they acknowledge that. The SIV might not have all the historical data if something's missing.
You have to get the shot again.
Well, you can update it, either by getting any missing vaccines that are appropriate for your age, or if you have other proof, like an old record, you can use that to update the digital certificate.
Okay, that makes sense. And getting the certificate, is it complicated or expensive?
No, that's another key point. It's completely free to request it, and you can get it as many times as you need.
That's great. Free and accessible. Seems like a good blend of digital efficiency and respecting older methods.
Yeah, it avoids making things unnecessarily difficult for people.
Okay, let's shift gears a bit. Let's talk about COVID-19. We've got stats up to March 2025. What do these numbers tell us about Uruguay's experience?
Well, the figures give us a pretty clear snapshot. By late March 2025, they'd recorded just over 1 million infections, 1,042,758 to be precise.
And sadly, deaths as well.
Yes, around 7,700 total deaths attributed to COVID-19. That puts the overall infection rate at about 30.75% of the population, and the case fatality rate at 0.74%.
0.74%. How does that compare generally?
It's relatively low compared to many places, which often points towards good healthcare access or, significantly, high vaccination rates.
And the vaccination rates were high, weren't they?
Exceptionally high. By the end of December 2023, the data shows 88.8% of the population had at least one dose.
Wow. Nearly 90%.
And 85.6% were considered fully vaccinated. Those are really impressive figures, you know.
They really are. It suggests a massive public buy-in to the vaccination effort. Any hints in the sources about why the uptake was so good?
The sources themselves don't delve deep into the why, but you could infer things. Uruguay has a history of strong public health programs and maybe a generally high level of trust in institutions.
That makes sense. A foundation of trust probably helps a lot in a public health crisis.
Definitely. Of course, we always have to add the caveat that these numbers depend on testing levels and how data is collected. But still, the vaccination rates speak for themselves. A very robust response.
Okay, let's rewind a bit then. Let's look at the start of the vaccination drive. January 2021, the initial planning phase. What was the strategy?
It shows they were thinking ahead, even very early on. Back in January 21, they were already making deals.
With who?
With Pfizer, BioNTech, and Sinovac.
Yeah.
Locking in initial supplies, anticipating a mass vaccination program starting around April that year.
So proactive procurement.
Very. And they didn't just rely on direct deals. They also reserved 1.5 million doses through the COVAX program.
The WHO initiative for fair global access.
Exactly. So they were covering their bases, securing supplies through multiple channels. It showed a commitment both domestically and to sort of global equity.
That's quite strategic for a relatively small country. What was the goal? How many people did they hope to vaccinate initially?
The target was ambitious, 600,000 people per month.
Wow.
Yeah. Though the government did acknowledge, that this might be tricky logistically. especially since vaccination was voluntary.
Voluntary, aligned with WHO recommendations then.
Right, and they had a clear plan for who got it first. Prioritization was key.
Who was top of the list?
It was based on scientific evidence, focusing on risk and essential roles. So healthcare workers, naturally. Then people in education, teachers, staff, also residents and staff in nursing homes.
The most vulnerable and the front line. Makes sense.
Then after that initial group, the plan was to move to defense forces, police, firefighters, people in prisons, and those over 75.
A very structured, phased rollout. And did the vaccines arrive on schedule?
Pretty much, yeah. The first doses actually arrived on February 25th, 2021, so they could start rolling things out fairly quickly.
And that led to them eventually ending the health emergency.
Yes. Fast forward a bit, they declared the health emergency over on April 1st, 2022. That was after 752 days. And by early 2023, January 10th, a huge chunk, 82% of the population, had received at least 2 doses.
That timeline really does highlight how quickly and effectively they managed to vaccinate a large portion of the population.
It really does. A significant achievement.
Okay, so bringing us up to 2025, how has the COVID vaccination approach changed? What are the current recommendations?
Things have shifted, naturally. Now, the Ministry of Public Health, the MSP, recommends an annual booster dose, but specifically for populations considered at higher risk.
Not for everyone, then. A more targeted approach.
Exactly. It's for people over 70, those over 50 with comorbidities, anyone over 5 who's moderately or severely immunosuppressed.
Okay.
Pregnant women, people with Down syndrome over 5, and also healthcare workers in direct care roles based on their individual risk. And interestingly, caregivers of pediatric patients with immunosuppression.
Right. Protecting the vulnerable by vaccinating those around them, too. Is it still easy to get these boosters?
Seems so. It's still free, still voluntary. And they've actually gotten rid of the central appointment system.
Oh, so how does it work?
They just provide a map of all the vaccination centers. You check the map, find one near you, check its hours, and go. More decentralized now.
Which probably makes sense now that it's more about routine boosters rather than a mass campaign. Okay, let's switch tracks to travel. What about entering Uruguay? What are the rules now regarding vaccination?
As of August 2022, most of the COVID-related travel restrictions were lifted. Things got a lot simpler.
Good news for travelers. What's the main requirement?
Basically, you need to show proof of vaccination. It needs to be with vaccines approved in your home country, following the recommended schedule, and issued by your national health authority.
Okay. What if someone isn't vaccinated? Can they still travel to Uruguay?
Yes, there's an alternative. If you can't show proof of vaccination, you need to present a negative COVID test.
PCR or antigen?
Either one works. PCR or antigen. The key thing is it must be taken no more than 72 hours before you board your transport plane, ferry, whatever.
And from a proper lab?
Yes, from a certified lab in your country of origin or even a transit country. And this applies to everyone age 6 and older.
6 and older, okay. Anything else needed for entry?
Just one more thing, health insurance. All travelers need to have health insurance that covers them for their stay in Uruguay.
That seems sensible. And no more forms or health declarations?
Nope, those were dropped back in August 2022 as well. So it's pretty straightforward now. Vaccine proof or recent negative test, plus health insurance.
Sounds like a practical balance. And once you're in Uruguay, any ongoing recommendations?
The mandatory stuff is gone, but the Ministry of Health still advises caution. They recommend, using face masks in close contact situations and keeping about 2 meters distance from others where possible. Standard good practice, really.
Got it. Okay, now for people thinking longer term, what about residency? Are vaccinations required if you want to become a permanent resident?
Yes, it's been a requirement since 2018. The Ministry of Public Health mandates proof of vaccination for permanent residency applicants.
And that was a change from before.
It was an expansion, yeah.
Yeah.
Previously, the main thing needed for the medical certificate for residency was just an up-to-date tetanus shot.
Ah, okay. So what did they add in 2018?
For adults, so anyone over 18, they added the requirement to show proof of vaccination against measles, mumps, and rubella, the MMR vaccine.
MMR for adults. What about the paperwork for that? Does it need special legalization?
The decree itself doesn't explicitly say it must be legalized or apostilled, but it's generally recommended, just to avoid any potential hiccups. Better safe than sorry,
Good tip. And translation?
Usually not needed if the certificate is in a language using the Roman alphabet, like English, Spanish, French, etc. But if it's in a different script, then yes, you'd need a certified translation.
Okay. And for kids applying for residency, Under 18.
For children, the requirements are more extensive. They basically need to show they're up to date with the entire vaccination schedule required for Uruguayan children.
Which includes?
It's quite a list. Measles, which they typically get around age 5 in Uruguay, Hib B vaccine, chickenpox, hepatitis B around age 12, diphtheria, pertussis, whooping cough, tetanus, hepatitis A, PCV13, and polio. Basically, the standard childhood vaccinations.
That's comprehensive. What if an applicant, adult or child, doesn't have proof or is missing some of these?
Uruguay makes it pretty accessible to get caught up. They can receive any missing vaccines right there in Uruguay.
For free?
Yes, at any public health center, it's free. Or they could choose to go to a private center, though that would likely involve a cost.
So there are clear pathways to meet the requirement, even if you arrive without full documentation.
Exactly. And the ministry points out, look, these are vaccines already required for our own citizens. Applying it to residents is about equality and collective health.
Makes sense. Is there any way around it, like for medical reasons?
Yes, absolutely. If someone has allergies or specific medical conditions that prevent vaccination, they can get an exemption.
That seems fair and practical. Let's jump back quickly to the COVID vaccines themselves. Which ones did Uruguay actually manage to get hold of and use?
They were quite successful in procuring vaccines from 3 main manufacturers. They got Sinovac, which is also called CoronaVac,
Right.
Pfizer, and AstraZeneca. So a good mix.
And were they all used equally?
Looking at the data from around October 2021, nearly 6.3 million doses had been given out by then. Initially, Sinovac was used the most, likely because it was available earlier or in larger quantities at first. Then Pfizer and AstraZeneca became more prominent in the mix.
And I think you mentioned booster strategies earlier.
Yes, that's right. Starting around July 2021, Uruguay was quite proactive. They began offering Pfizer booster shots specifically to people who had initially received the Sinovac vaccine.
Why that specific combination?
The thinking at the time, based on emerging studies, was that Pfizer offered potentially higher protection rates, especially against newer variants that were popping up. So it was seen as a way to top up immunity for those who got Sinovac first.
That shows they were really watching the science and adapting their strategy as they went along. Very dynamic.
Definitely, an adaptive, science-led approach.
Okay, final piece of the puzzle. The public response. We know the rates were high, but let's look at the uptake more closely. How did people react to the campaign?
The reaction was, well, overwhelmingly positive. The uptake figures are quite something. By late July 2021, so relatively early in the global rollout, 0.62% of the entire population had already gotten their second dose, and 72% had received at least one dose. That's incredibly fast progress.
Huge numbers, very quickly. Was it easy to get a shot?
It seems vaccination was accessible pretty much everywhere. The sources mentioned the Department of Colonia as an example, where over 76% of people had actively registered online, expressing interest in getting vaccinated. High engagement.
Wow. Did uptake vary much across the country or by age?
There were some regional variations, yeah. Durazno, a department in the middle of the country, often seemed to be leading in terms of full vaccination percentages.
And Montevideo, being the capital and largest city.
Montevideo, home to about half the country's population, had nearly 61% fully vaccinated by that same point, July 2021. Still very high.
And age groups.
What's really striking is how quickly all age groups embraced it. They started with 55 and older, then progressively opened it up to younger people. And the uptake among teenagers, 12 to 19-year-olds, was notably fast.
Teenagers got vaccinated early.
Yeah, Uruguay was actually one of the first countries in Latin America to include adolescents in their national plan. And the kids, well, their families, signed up quickly.
That really paints a picture of a nation pulling together on public health.
It really does.
Okay, so wrapping up this section, this whole overview really drives home Uruguay's very proactive stance on routine shots, on the pandemic response, the high rates, the easy access to certificates, clear rules. It all points to a strong commitment.
Absolutely. And if you sort of connect the dots, look at the bigger picture. Uruguay's reputation as one of Latin America's most stable, democratic, prosperous countries. This focus on public health fits right in.
Perhaps so.
Well, this emphasis on health aligns with a broader societal focus on well-being, on security. These are factors that, might be really important if you're considering visiting or maybe even moving there.
Like the residency requirement for vaccination.
Exactly. That signals how much they value collective health. And the sheer ease of getting records for residents and travelers alike, that speaks to a really organized, forward-thinking public health system.
So what does this all mean for you, the listener?
It means you're looking at a country that puts a high priority on health and has solid systems in place to back that up. It's definitely something to consider. And hey, for more detailed info about Uruguay in general, check out realestate-uruguay.com.
Okay, we've covered a lot of ground today in this deep dive on vaccinations and health in Uruguay. We've explored the national program, looked closely at their really quite impressive COVID-19 response, and seen how vaccination is key for travelers and residents.
Yeah, the high vaccination numbers, the straightforward way you can get your certificate, the clear rules for entry and residency, it all paints a picture of a country that genuinely takes public health seriously.
It really does. And that brings up a final thought, perhaps, for you to consider. When you think about traveling, or even where you might want to live, how much does a country's approach to public health like this factor into your decision? Something to mull over.
Definitely food for thought.
Thank you so much for joining us for this exploration of vaccinations and health in Uruguay. For more information, do remember to visit realestate-uruguay.com.
Thanks for tuning in.
And thank you for listening to the Vaccinations and Health in Uruguay podcast.